Hey guys, Adam from Simple Physiotherapy introducing a new video regarding Achilles tendinitis. So when looking at Achilles tendinitis, we first need to look at what is the Achilles tendon. So the Achilles tendon is a tendon that joins the calf muscles in the bottom of the leg, just below the back of the knee, into the heel. The calf muscles in the back of the lower leg are used to come up onto your toes and point the ankle towards the floor, or point it away from the body. This is essential when walking, running, to make sure that you can clear the floor. Achilles tendinitis is caused when the Achilles tendon cannot cope with the load being put through it and the stresses it's being put under. And this stress beyond its capability causes a little bit of micro trauma, which can cause a bit of inflammation around the area. Sometimes it swells, not always, but this causes pain and inflammatory response in the body. Achilles tendinitis is often seen in runners because they have that repeat trauma to the Achilles tendon, or a repeat loading to the Achilles tendon when they're running. Most often actually seen in long distance runners, or people who have suddenly started up running because they're not used to it. The body's or the tendon's capacity isn't enough to cope with the sudden increase because of the fact that it's not conditioned to do so. In physiotherapy, to treat Achilles tendinitis, there's a few things we can do. The gold standard treatment, or the first port of call, is to look at rehabilitation exercises. So they often include exercises that load the tendon, so its load capacity can meet what you're putting it through on a daily basis, slowly increasing the load going through the tendon over time so that it can adapt and cope with that stress. Exercises that can also be added could be stretching type exercises, because you often get a bit of tightening of the calf muscle. If it's not quite strong enough, it tends to get quite tense, and that puts extra stress on the tendon. So if we can stretch that out, it can often help as well. But out of the two, the loading exercises are a priority. If your Achilles tendon is particularly painful, there are some other treatment options out there as well. If the exercises aren't tolerable, you can have other manual therapies like sports massage, for example, or acupuncture. They both will help in the short term in reducing the amount of pain that you're in. They inhibit the pain pathway to a certain degree, so you might be able to get a bit more out of the exercises afterwards. I wouldn't advocate using massage or acupuncture as the sole treatment because at the end of the day, the problem is caused, or the tendinitis is caused, by the fact that the tendon isn't strong enough to cope with the stresses you're putting it under, and there's no amount of massage or acupuncture that will increase that load capacity. It will feel better afterwards, but it will go back to the way it was before unless you do the exercises. You can use taping as another treatment option. It hasn't got fantastic evidence behind it, but for some people it can really help if it's particularly painful. In some cases, if the Achilles tendinitis is very persistent and it doesn't ease, there are two sort of last resort options that I've used on a very few occasions. One of them being putting insoles in the shoes. Sometimes if the ankles are rolling in, for example, or there's a bit of instability, for example, around the ankle, that can stress the tendon a little bit more. So the insoles can work on stabilize the ankle a little bit more, so there's less stress on the Achilles tendon. Again, I wouldn't advocate using them so much in the long term. It'd be better to look at exercises to help incorporate and strengthen the muscles to stabilize the ankle, so you're not dependent on any insoles, or if you lose the insole or something happens to them, that it doesn't come back because you've got that inherent instability there. And on very, very rare occasions, you can have a night splint as well. It's not particularly pleasant or particularly comfortable, but what it does is essentially brings your toes up towards you, so it stretches the calf muscles out, and if you wear that at night, it's aimed to try and stretch out those muscles to ease the tension on that Achilles tendon. It can be quite effective, but it's not very comfortable, and I wouldn't advocate that as a first port of call, to be honest. So how long does Achilles tendinitis take to heal? That is really variable from person to person. General guidance is it can take, sometimes it takes about 6 weeks for some people, sometimes it can take several months. it is really variable. It all depends on how much stress that Achilles tendon is under on a daily basis. For example, if you are doing a job like you're a chef, for example, and you're on your feet a lot, then it doesn't have that chance to rest as much. So there's that higher load that's needed, and that capacity needs to meet that. So the exercises you might have to do for a little bit longer and be close to that several month mark. But some people who have the opportunity to rest might see a difference a lot quicker. But then also it depends on how much pain you're in. Some people who have more severe pain may not be able to do as many repetitions with the exercises, or starting off at a lower level and need to build it up, and it takes that little bit longer. It is really variable. I would say the longest it's ever taken that I've seen to get better is a couple of years. But then having said that, I've seen some people get better within 6 weeks. So it is very, very variable. I hope you found this video on Achilles tendinitis helpful and you've got some benefit from it. If you have found it helpful, please leave a like and subscribe, and leave a comment below for any other suggestions of things that you might want me to cover in the future.